Sawadika, very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip Naksongpoplao.
We'll begin tonight with the latest developments on the COVID-19 vaccinations. Recently, the National Vaccine Committee has approved the procurement of another 120 million doses of COVID-19 vaccine for next year, as well as the allocation of vaccines for exports to other countries. Dr. Nakorn Premsi, director of the National Vaccine Institute, said the procurement is for those who still cannot access the vaccinations, those who require booster doses, and some to be held in reserve in case of another outbreak. At the same time, the Disease Control Department and the National Vaccine Institute will also try to procure up to 100 million doses as projected. The committee also approved the allocation of vaccines for export to other countries, for which the Disease Control Department and the National Vaccine Institute must fully consider the downsides and negotiate with vaccine producers to procure a quantity in line with the prevailing COVID-19 situation in the country. Meanwhile, Dr. Opat Gawinpong, Director General of the Disease Control Department, said that the committee did not consider the Prime Minister's suggestion of a mix and match of vaccine makes following the WHO's warning of the concept. However, there is another academic committee considering the issue. He noted, though, that the WHO's warning statement is very long and that quoting only certain parts out of context may lead to misinterpretation. On Monday, the World Health Organization's chief scientist advised against mixing and matching COVID-19 vaccines from different manufacturers, calling it a dangerous trend since there is very little information or research into the potential outcomes. She said we are in a data-free, evidence-free zone here as far as mix and match. There is only limited data on it. It will be a chaotic situation in countries if citizens start deciding when and who will be taking a second, third, and fourth dose of different types.
I just think it's very important to take experts' opinion into consideration. Doesn't mean we have to believe everything, but they are scientists and experts for a reason.
Right.
And this thing need more study just to be sure. And I think Thailand has been studying about mix and match between AstraZeneca and also Sinovac. We reported that before, and the result is quite satisfactory for a lot of scientists because some people allergic to Sinovac, so they have to take AstraZeneca as second dose, and now there's a chance a lot of people that have AstraZeneca, allergic to AstraZeneca, they might have to take other kind of vaccine as a second dose.
Exactly, because of the widespread of the Delta variant, that's why people, especially with the medics, are considering the mix and match between Sinovac and AstraZeneca vaccines.
Yes. Now, let's talk about the home isolation because we have reported before that Bangkok is having problem with the hospital beds and how to allocate those beds to people. And the government tried to consider other plans. And finally, we have this program called Home Isolation Scheme that designed by NHSO. The Home Isolation Scheme, where asymptomatic and mild COVID-19 cases are asked to stay at their home with online care from medics, started today under the Warm Community Clinic banner, with as many as 1,283 medical volunteers in support. The scheme is to provide a solution to the current hospital bed shortage caused by continuously rising infections and deaths in the country. The virtual clinic, which is a National Health Security Office or NHSO initiative, involves numerous doctors, nurses, and pharmacists monitoring and caring for their patients in home isolation through video calls. Dr. Supatra Simanichakan, the president of the General Practitioners and Family Physicians Association of Thailand, heads the support team at the clinic and the NHSO's 1330 hotline, where she explains that they assist the registrations process, including the patient classification and the monitoring of health conditions via telephone and line messaging app. They also watch over medical personnel working closely with the communities. For asymptomatic and mild cases, medics will deliver medication, including the Thai herbal medicine Pharmaceutical and other necessary equipment. As for moderate to severe cases waiting for hospital beds, the medics will contact the 1330 hotline to assist in finding beds. Antiviral favipiravir tablets will be prescribed until the patients find a hospital bed, pending Thailand's Food and Drug Administration's approval of its use. So far, the Julapur Royal Academy has reserved 5,000 tablets and is coordinating with hospitals to reserve more of the medication. The volunteers can monitor up to 1,000 patients per round, while the nurses will be split into 4 teams to monitor their assigned patients for 14 days or until the patient has recovered. With an estimated 40,000 patients in Bangkok and nearby provinces waiting for hospital beds, more medical volunteers are, however, still needed. Meanwhile, Vice President of the Royal College of Family Physicians of Thailand, Dr. Sairat Noknoy, said that the doctors will provide advice to people on how to isolate, how the medics can keep track of the patient's conditions through phone calls online, record body temperature and oxygen levels, and monitor their mental health to assess any possible psychological deterioration during isolation. President of the Royal College of Family Physicians of Thailand, Dr. Aphinan Apanrat, also explained that the college has taken care of patients staying at home before and that, from experience, the important thing is to calm the concerns of the infected, their families, and their communities. And speaking of hospital bed shortage due to continuously rising infections, let's now take a look at today's COVID-19 figures. The number of the infections across Thailand surged by 9,317, bringing the total in the current wave to over 334,000. Thailand records 87 more deaths were reported today, bringing the total of deaths since April to 2,840. Bangkok alone makes up about 1/3 of all infections in this wave, having logged over 2,300 cases today and almost 104,000 cases overall. So that is a big number. We're still on high 4 digits, 8,000, 9,000 for several days now.
And with the high number of deaths as well, recently we just reported that a number of funerals could not take the cremation anymore because, like what you reported yesterday, where if you cremate like many cases in one day, the furnaces may not be able to take it anymore. And recently, the Thammasat University Hospital has rented 2 refrigerated shipping containers to be used to chill the corpse of COVID-19 victims because the existing mortuaries do not have the capacity to handle the increasing number of people dying from COVID-19 as well as other causes. A post on the hospital's Facebook page indicated that it was reluctant to tell the public about the overcrowded mortuaries, but it has to tell the truth about the problem now and in a foreseeable future, so all sectors of society can brace for a worst-case scenario in Thailand's healthcare system. The post said that the hospital's forensic science unit has the responsibility for Pathum Thani province and its vicinities and is therefore duty-bound to examine victims who die at home or in road accidents in its area of responsibility to determine the cause of death, adding that the number of people dying, including from COVID-19, is steadily increasing and will soon overwhelm the hospital's current mortuary facilities. Associate Professor Dr. Purahato Udom, director of the hospital, told Thai PBS that the mortuary normally accommodates 2 to 3 cadavers of those who die at the hospital, 2 to 3 of those who die in road accidents, and others from several central provinces. He disclosed that the hospital is treating 70 to 100 COVID inpatients on a daily basis, and of these, 2 or 3 pass away every day. He said that normally relatives of the dead are required to collect the bodies within 24 hours of death, but since the COVID-19 outbreak, many may be in quarantine and unable to arrange for collection of the deceased family member for several days, resulting in the hospital having to store them for 3 to 5 days. Dr. Prahat said the 2 refrigerated shipping containers each have a capacity to store 15 cadavers and are expected to be delivered in the next few days. Currently, 79 COVID-19 patients are being treated at the hospital, including 34 severe cases in the ICU, while 307 others are undergoing treatment at its field hospitals. Expressing grave concern over the worsening pandemic situation, Dr. Prahat said he expects more deaths and for new infections to soar to more than 10,000 cases a day if the pandemic is not effectively contained. Several temples in Bangkok have also complained that their crematories are cracking because of the heat caused by the continuous cremation of an increasing number of victims of COVID-19. And there is a broken crematory at Wat Khanok Temple in Chonburi, which is being repaired and will resume operation this Sunday. The repairs follow the House Speaker Chon Lik-pai's petition to Prime Minister Prayut Chan-o-cha for a budget to fix and maintain the crematory, as many more COVID-19 victims are awaiting cremation. And this is according to Chuan's Secretary Somboon Uthaiwienkul, who is also calling on the government to accelerate vaccination of undertakers, Buddhist monks, and rescue foundation staff who handle the bodies of COVID-19 victims. So we can see that with the increasing number of deaths, and it looks like it's not going to slow down, many of the temples are asking for help right now.
Actually, when we report the story of 2 temples in Nonthaburi yesterday, there's some people on social media ask us that why the number of deaths that's not even 100 per day become problematic right now to these temples. We have to reiterate that not every temple except COVID-19 victims and these 2 temples that we reported yesterday, they provided a service for free. So it's when they provide services for free, bodies usually land at that temple. And like they said, if they have to do the cremation 3 or 4 in a row, their crematories doesn't have the break time, it gets overheated and it's broken down.
Exactly. And when it's overheated, it's very likely that it will malfunction one day, and we can sort of understand what they had to go through, and they had to do all of these ceremonies up until 3 a.m. in the next day. That is definitely very tiring, and we don't see this so often, especially during pre-pandemic levels. We've never seen any of the ceremonies going after midnight.
Yeah, because usually Thai Buddhist ceremony will last like 7 days, and it has a certain time. It finishes around 7 and 8, and then the next part of the ceremony do it the next day. But for the COVID-19 system, the protocol is they have to cremate the body as soon as possible. So they try to finish everything in 1 day. So that is making everything more complicated.
Exactly, and it's very overwhelming as well.
Now let's talk about the package, the relief package that the government is trying to launch to help with the economic situation in Thailand. Last night, the cabinet rolled out financial packages to help employees and employers in 9 types of businesses and freelancers in the 10 provinces in the dark red zone, and Bangkok also included. Prime Minister Prayut Chan-o-cha said that the financial assistance will be for 1 month, but may be extended if the situation warrants it. And in addition, small, medium, and large households and businesses, especially nonprofit organizations across the country, will have their water and electricity fees cut for July and August. The financial package will cost taxpayers about 30 billion baht for the month, while the utility rate cuts will cost another 12 billion baht over a 2-month period. The 9 types of businesses entitled to financial support include construction, lodging and food services, art, entertainment and recreational activities, wholesaling and retailing and vehicle maintenance services, transport and warehousing businesses, management and support services for science and technical activities, communications and information services. Employees under the Section 33 of the labor law working in any of these business types are eligible to receive half of their salaries, but not more than 7,500 baht during the 1-month period. Employees who are Thai citizens will receive an additional 2,500 baht. So if you are Thai citizens, you're eligible for 10,000 baht a month. Employers who receive 3,000 baht for each employers will also receive 3,000 baht for each employee, but not more than 200 employees. For former employees under Section 39 of the labor law who are unemployed for up to 6 months and who are still covered by the Social Security scheme, and freelancers will be entitled to 5,000 baht each. However, freelancers must register under Section 40 of labor law within this month to be eligible. Businesses who have employees not covered by the Social Security scheme must register under Section 33 within July to be eligible to receive the support for their employees and for themselves. 3,000 baht for each employee under employment, but not more than 200 employees, just to be reiterated on it. Businesses which do not have any employees and are not covered by Social Security schemes must register under Section 40 this month to be eligible to receive the financial support. Businesses subscribed to the 50-50 co-payment and Racha schemes which do not have any employees must also register this month under the Section 40 in order to receive 5,000 baht support. So for households which consume less than 150 units of electricity, the first 90 units are free of charge. Those which consume more than 150 units, if the power consumed is lower or equal to the amount used in February, actual usage of the electricity will be charged. So they use the February electricity bill as a threshold. So if more than in February, but not exceeding 500 units, the charge for February will be applied. But if it is 501 to 1,000 units are consumed, the fees charged will be equivalent to the fees for February plus 50% of the normal rate for the excess used. For small enterprises, the first 100 units are free of charge. And for water fees, only households and small enterprises are eligible for 10% fee cuts for July and August. The Finance Ministry and the Bank of Thailand have been told to discuss with commercial banks ways to ease debt repayments for their debtors, both private individuals and businesses. The Prime Minister said that this financial package will cost the state a substantial portion of its budget, but he finds assistance is necessary to help people during the crisis. So if you have been on Social Security scheme, this is probably be something that benefit you. But if you haven't been on Social Security scheme, you have to check the detail, how to apply and how to get on this program with the government.
Exactly. And now let's move on to another big issue. Thailand's government pharmaceutical organization, or the GPO, has lodged a complaint with Payathai police in Bangkok accusing Dr. Bun Wanasin and Mr. Loy Chun Pong Tong of spreading false information about profit being sought in the Moderna vaccine procurement process to discredit the organization. Dr. Bun is the chairman of the Chonburi healthcare group, whereas Mr. Loy is a well-known mathematician and astronomer. The GPO acts on behalf of private hospitals in ordering the Moderna vaccine, as only government agencies, with the exception of the Chulalongkorn Royal Academy, can procure them. In its complaint, the GPO accuses the two men of defaming the organization by providing false information to the public, causing the public to incorrectly believe that the organization is making huge profits from the procurement. The GPO also explained in a statement that is issued today that it was assigned to act as a go-between to procure alternative vaccines for the private sector without making a profit. It also said that it finds it necessary to resort to litigation against Dr. Boon and Mr. Loy because their false claims about the vaccine deal have damaged the organization's reputation. Meanwhile, Mr. Loy explained on his YouTube Loy Academy channel yesterday that he did not spread fake or false news about the GPO's vaccine deal as alleged, but merely wanted to know how the state-owned organization came up with a price of 1,100 baht per dose of Moderna vaccine charged to private hospitals when the prices charged by the manufacturer are around 17 to 18 US dollars per dose to the US government and the European Union, or around 584 baht per dose charged by its distributor in Thailand. Mr. Loy said the GPO is charging private hospitals 1,100 baht per dose, which is inclusive of 7% value-added tax and other expenses, and private hospitals are charging the public 1,650 baht per dose, including the insurance coverage. Although private hospitals are entitled to claim the 7% VAT refund from the state, he said he wondered if any private hospitals will refund members of the public who pay for the vaccine shots at the hospitals. He asked why the GPO did not ask the government to waive the VAT from the beginning so that it would not be a burden on the people. He also recommended that all government hospitals procure mRNA alternative vaccines for people free of charge, citing Section 47 of the Constitution, which stipulates that they are entitled to protection against communicable diseases from the state free of charge. Mr. Loy also claimed that what he had done so far is to protect Prime Minister Prayut Chan-o-cha from public criticism, stating that he has done it in good faith, noting that people want the vaccine but wonder why it is so expensive.
Well, the price is one thing, but how difficult to get on to book some of the doses from hospitals is another thing. It's quite difficult. I mean, I tried myself on Monday and I spent like half a day, go through all the process, get in the waiting list, the website crashed and then pay for it and things like that. So yeah, the price is one thing and the process is another thing. It's a long process of trying to get vaccine that we have to pay for.
Exactly. And we're one of those people who tried to apply for the Moderna vaccine and with no clue when we're going to receive them. The process itself is already complicated and it took us really long just to get a confirmation from the hospital whether we are eligible for that vaccine.
So they say it's going to be the last quarter of this year, but it's 3 months in that last quarter of this year. So it's either going to be October, November, or even December. So we don't know yet.
Right.
Anyway, we have a special report coming up. Our correspondent went down to Pattaya in Chonburi province to talk to several people in hospitality industry about how they adapt themselves in this COVID situation and talk to some employees that how they feel that they have to try to be multitasking and try to perform other tasks or responsibility that's not in their major skill set. Now let's take a look at this report.
ในแต่ละรอบตั้งแต่โรงแรมนี้เปิดมาคือโรงแรมเปิดมาเมื่อตอนต้นปี 2020 ดังนั้นเนี่ยเว็บแรกก็ทำให้โรงแรมต้องหยุดให้บริการชั่วคราวแล้วก็เรากลับมาเปิดอีกครั้งหนึ่งก็คือเดือนตุลาในปี 2020 คือปีที่แล้วใช่ไหมครับเปิดได้สักพักก็เจอระลอก 2ก็เลยทำให้ดีมานด์เนี่ยมันก็หายไปอีกและในส่วนของที่เป็นเว็บ 3 เนี่ยครับก็เราถือว่าเราค่อนข้างโชคดีในกลุ่มธุรกิจโรงแรมในโซนนี้เหมือนกันนะครับเพราะว่าเราปรับให้เป็นโอกาสคือหลายๆโรงแรมเนี่ยก็เปลี่ยนไปทำเป็น ALQ เองหรือว่าทำเซฟเฮาส์เองเพื่อที่จะให้โรงแรมได้รันต่อไปใช่ไหมฮะ ก็เราก็คิดว่าเราค่อนข้างโชคดีกับเว็บ1เว็บ2และเว็บ3นะครับ
As occupancy rates have declined by more than 80%, some hotels in many cities have converted to be alternative local state quarantine facilities. These hotels have to adopt the COVID-19 health and safety standards, implement workforce optimization, and increase user of digital platforms.
ทางโรงแรมเองก็มี IHG Clean Promise ที่เป็นโปรแกรมที่จะมาช่วยซัพพอร์ตให้พนักงานได้ follow ได้ทำตามแล้วก็ปฏิบัติตามอย่างเคร่งครัดเพื่อที่จะรักษาลูกค้าให้กลับมาใช้บริการกับเรานะครับอันนี้ในเรื่องแรกแล้วก็เรื่องที่2ก็จะเป็นเรื่องของ workforce optimization เราก็มีการ restructure ในส่วนของพนักงานให้เข้ากับ business ที่เรามีซึ่งหมายความว่าเรามีการปรับแผนพนักงานปรับจำนวนพนักงานแล้วก็การใช้ multi task multi skill เพิ่มเข้าไปแล้วก็เรื่องที่3ก็จะเป็นเรื่องของ commercial driven ตัวนี้ก็เราก็ต้อง increase ตัว digital platform ให้เยอะขึ้นเพื่อที่สื่อสารกับสังคมให้รู้ว่าโรงแรมมีมาตรการยังไงในการป้องกันโควิดหรือว่ามาตรการยังไงที่จะทำให้ลูกค้าได้เข้ามาพักในโรงแรมนะครับ
At the moment, the hotel employs about 80 staff. To operate 347 rooms, the number of employees would definitely not be enough in a normal situation. As far as workforce optimization is concerned, one person has to handle more responsibility than before, regardless of their position.
ช่วงโควิดที่ผ่านมาก็ทำให้เราได้ทำงานมากขึ้นนอกจากงานของตัวเองแล้วก็ยังมีงานที่เราต้องซัพพอร์ตแต่ละแผนกที่เราต้องช่วยกันให้ผ่านพ้นวิกฤตนี้ไปด้วยกันได้ครับใช่ซึ่งตอนที่มี manpower เยอะกว่านี้เนี่ยเราก็จะมีหน้าที่ที่เป็นของเราแล้วเราก็จะโคกันบ้างเล็กๆน้อยๆแต่ว่าเราได้ลงมารู้จักกันมากขึ้นลงมาช่วยกันมากขึ้นอะไรแบบนี้มากกว่าในช่วงที่เป็นแบบนี้เพราะจำนวนคนมันน้อยลงจริงๆครับ
The hotel generates more revenue by selling takeaway meals right in front of the hotel every evening, cooked by the hotel chefs. The GM said the good thing is that employees in this hotel have opportunity to enhance their multitasking skills, have fun, earn some extra incentives, and above all, demonstrate their team spirit by supporting their fellow staff.
การที่เรามาขายอาหารกล่องหรือว่าเหมือนข้าวราดแกงโดยทีมที่ขายเนี่ยเชื่อไหมครับว่าเป็นทีมทำงานหลังบ้านก็คือ accounting มาช่วยขายอะไรเงี้ยก็เป็นการทำ multitasking อะไรอย่างเงี้ยครับเขาก็ได้สนุกด้วยแล้วก็มี revenue opportunity เพิ่มขึ้นมาด้วยซึ่งก็ได้รับการตอบรับค่อนข้างดีใช่คือทีมก็ได้ engage คือเขาก็รู้ว่าโอเคทีม kitchen มีความลำบากในการเตรียมอาหารทีม service ในการ prepare อะไรอย่างเงี้ยครับคือทุกคนก็จะเข้าใจแล้วก็ช่วยเหลือซึ่งกันและกันมากขึ้นนะครับ
Employees do have their core expertise, however, which means not just anyone can replace those particular positions. That's why the management opted for hiring temporary workers rather than put its permanent staff to take a role in which they lack skills and experience.
จริงๆแล้วเนี่ยคือเราเลือกที่จะให้เขาทำงานในส่วนของเขาเป็นหลักมากกว่าโดยที่เราเองก็พยายามคำนวณ manpower ให้มินิมัมที่สุดแต่ว่าก็ไม่ได้มินิมัมจนแบบทำงานไม่ได้ยกตัวอย่างเช่นอย่างหน้าฟรอนต์เองตรงนี้นะครับเขาก็จะรู้ครับว่าถ้าอย่างน้อยต้องมี1คนต่อรอบเนี่ยเราคำนวณแล้วเนี่ยเราต้องมีพนักงานทั้งหมดกี่คนหักจากวันหยุดที่เขาต้องหยุดไปชดเชยกันไปกันมาเนี่ยอย่างน้อยเนี่ยเขามีคนเพียงพอที่จะดูแลลูกค้านะครับทีนี้พอเราได้ลูกค้าองค์กรมาเนี่ยนะครับเราก็จะสามารถวางแผนได้ว่าช่วงไหนเราต้องใช้คนมากขึ้นนะครับเราก็เลยเลือกจ้างคนที่จะมาทำชั่วคราวที่ในช่วงที่แบบว่ามีแขกเข้ามามากขึ้นมากกว่าครับเพราะผมเชื่อว่าโอเคในบางครั้งนะครับในบางครั้งเราก็สามารถที่จะแบบว่าวนแผนกอื่นมาช่วยกันได้บ้างแม้กระทั่งแบบวนทางพนักงานหน้า front office ของเราเนี่ยไปช่วยทาง F&B ตรงอื่นได้บ้างเนี่ยแต่ว่าสุดท้ายแล้ว experience ที่แขกจะได้รับเนี่ยมันไม่เท่ากับคนที่เขามีความสามารถในด้านนั้นจริงๆ
กติจะอยู่ใน
This gentleman, who prefers to remain anonymous, is front office staff at a hotel in Pattaya. His organization has reduced the number of workers to the very minimum. Therefore, he has to help support other sections. It is normal work demands in an abnormal situation.
จากโควิดเนี่ยทำให้เกิดเป็นค่าใช้จ่ายที่มองไม่เห็นนะครับในส่วนของเราจะต้องใช้คนที่ดูแลส่วนของจุดตั้งจุดแอลกอฮอล์หรือการลงทะเบียนอะไรต่างๆขึ้นเงี้ยมันเป็นคอสที่มองไม่อยู่ในเยียร์แพลนมาก่อนนะครับก็จะต้องไปซัพพอร์ตตรงนี้เหมือนแต่ก่อนเคยจ้างจากส่วนหน้าจ้าง3คนก็ต้องเป็นจ้าง5คนเพราะต้องมีทั้งวัดอุณหภูมิแล้วก็ในการสกรีนคนเพื่อทำความเข้าใจให้เข้าใจของการเข้ามาทำเช็คอินอะไรเงี้ยครับก็คือจะใช่ครับผมแล้วก็สกิลของคนที่มาทำเนี่ยมันเป็นค่าสกิลครับของการเรียนรู้ใหม่การเทรนนิ่งใหม่อะไรอย่างเงี้ยทุกอย่างเพราะว่าแขกไม่ได้เยอะเหมือนเดิมเราก็จะพยายามใช้พนักงานของเราเองในโรงแรมเนี่ยในการมาทำตรงนี้ซึ่งเนเจอร์แต่ละคนไม่เหมือนกันบางคนทำในส่วนของครัวแต่ต้องมายืนข้างหน้าเนี่ยหรือว่าพนักงานบางคนขายของต้องมายืนข้างหน้าโดยเริ่มแรกเนี่ยโดยธรรมชาติเขาไม่ได้มีความรู้สึกที่อยากจะทำกำลังจะบอกว่ามันเป็นในมุมของคนที่เขาซัฟเฟอร์ในของเขาไม่ได้ตื่นทุกวันที่ไม่อยากทำงานในสิ่งที่เขาทำมันจะมีผลทางด้านจิตใจมากกว่าทางด้านของรายได้อย่างเดียวอะไรอย่างเงี้ยครับ
Multitasking has its downside. It is interesting to find out that it causes incredibly high pressure and turnover rate among hotel workers in Pattaya.
มันเสี่ยงกับการที่จะถูกคอมเพนที่ตื่นมาทุกวันไม่ได้อยากทำงานที่ตัวเองมาทำอยู่อะไรเงี้ยแต่ต้องทำเพื่อเหมือนกับเพื่อแบบรักษาองค์กรให้ไปได้อะไรเงี้ยมันจะเป็นอยู่ที่ attitude กับ mindset ของพนักงานเองด้วยอะไรเงี้ยสิ่งที่เกิดขึ้นเนี่ยก็คือมีการลาออกเยอะมีการ turnover เยอะเพราะบางคนรู้สึกว่าจะเลือกที่จะ check it or leave it เมื่อเขาไม่แฮปปี้ที่จะทำเขาก็รู้สึกว่าเขาก็ไปดีกว่าเพราะเขาไม่ได้ทำสิ่งที่เขาอยากทำการตื่นมาทำสิ่งที่ไม่อยากทำทุกวันมันไม่แฮปปี้อยู่แล้ว
Moving on from Pattaya, if you've been to Thailand a couple of times, you may have been familiar with this tiger zoo, which is called Sriracha Tiger Zoo, because it has welcomed both Thai and foreign tourists for 24 years. But the sad news is that the Sriracha Tiger Zoo, which is one of Thailand's famous tourist attractions, announced its permanent closure after 24 years in operation, citing the COVID-19 pandemic. On the zoo's webpage, the management said that since the outbreak of the first wave of the pandemic early last year, it has struggled and tried all possible means to earn revenue, including selling street food and offering promotional free entry to visitors to keep the business afloat for the sake of its staff and the animals at the zoo. The pandemic has continued to return in wave after wave. With the onset of the third wave since April, the management says that it can no longer carry on with the business as there are no foreign tourists at all. As for about 5,000 animals at the zoo, including tigers, crocodiles, camels, elephants, horses, deers, and others, the management said that it will move them to a new home on land belonging to the company. In May, the zoo put 11 elephants up for sale at 3 million baht each, but the Department of National Parks, Wildlife and Plant Conservation said the elephants are protected species in Category 1 of the CITES convention, as well as by the Thai Wildlife Protection Act, and cannot therefore be sold or purchased unless they are exchanged between zoos for research or propagation with permission. As whether the zoo will resume operations again, the management said that for the time being, it could not predict the future, but they hinted that if the pandemic situation eases, they are ready to listen to proposals from the investors. It also said that they might build a new landmark somewhere which might be bigger, adding that the company has already registered the Sriracha Tiger Zoo trademark. The zoo officially opened on April 23, 1997, with Mr. Maitri Temsiripong, a former pig and crocodile breeder, as its founder and chairman. At its peak, the zoo catered to about 1.5 million tourists each year, mostly Chinese, Indian, Vietnamese, Indonesian, and Russian. And the zoo is also a center for the breeding of Royal Bengal tigers. In 2004, the Animal Welfare Institute, a U.S. nonprofit organization, reported that the zoo has been using tigers and elephants in circus shows. It also came under scrutiny after it shipped 100 tigers to a Chinese zoo. In 2016, the London-based World Animal Protection reported that the tigers appeared in poor condition, with tiger cubs being separated from their mothers just 2 to 3 weeks after birth. So if you hope to visit the tigers or any other animals at this zoo, unfortunately, you can't do it anymore because they already announced the permanent closure. But at the same time, they sort of hinted that they might move to a new landmark because they already registered their trademark.
We have been hearing several reports of many places that they usually deal with the animals and they have to close down. We also had report about this elephant sanctuary in Pattaya just weeks ago from Gittipachin Sukjit. They're also facing problems as well because the income is not as much as they used to have before because of lack of tourists. So just have to see whether the government will be able to help any of these businesses before they all have to close down.
Exactly. And these places actually attract a lot of foreign tourists as well.
Yes, and that's all the news we have in this edition of Thai PBS World Tonight. You can follow us on our website, www.thaipbsworld.com. We also have social media. We have YouTube, Facebook, Twitter, Instagram, and TikTok.
Thanks for watching. Stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ